hold the first ever summit of the UNAIDS Lancet Commission from AIDS to Sustainable Health. This will be held from 28th to 29th June this same month. Now in this program, I have panelists that will help me to try to explain some of the issues to do with this particular commission, and of course the issues to do with HIV/AIDS, what the nation is doing, and we'll hear it from the civil society, from government, and of course National AIDS Commission. So we have three panelists in this program. I'll allow them to introduce themselves. We'll start from my immediate left. Can you introduce yourself?
I'm Charles Mwansambo. I'm Secretary for Health.
And there?
I'm McDonald Sembereka, a special advisor to the President on NGOs and civil society.
To my far left there.
I am Thomas Bisika, Executive Director, National AIDS Commission.
Well, those are our panelists in this panel discussion. Now, to start with, I think we have to start with you, Reverend McDonald Sembereka. I know on Wednesday you issued a press statement announcing the first summit of UNAIDS Lancet Commission from AIDS to Sustainable Health. Firstly, what is this commission all about, and how does Malawi come into the picture?
Thank you very much. This commission is the first of its type that will map out the way forward in as far as the response to HIV and AIDS is concerned from 2015 ahead. Currently, as you are aware, there are consultations going on to shape the agenda from 2015 after the Millennium Development Goals its lifespan has elapsed. So certainly the UN has empaneled this commission, this special commission, that will shape the agenda post 2015 and make sure that issues of HIV are dealt with as appropriately as it would be.
Right. Is there any reason why Malawi is the venue?
Malawi is the venue because our head of state, who is Her Excellency the State President, Dr. Joyce Banda, was requested at the invitation of the UNA to sit as the co-chair of this commission. And it pleased Her Excellency to invite the first face-to-face sitting of the commission to sit here in Malawi as a first encounter, and to avail the members of the commission an opportunity to learn from what Malawi has done in the past, but at the same time we benefit from their skills and expertise and knowledge on how they have dealt with the epidemic elsewhere.
Right. That now takes me to maybe the next question. Why do you think UNAIDS chose Her Excellency the President, Dr. Joyce Banda, to co-chair this commission? Any special attributes that maybe made the commission to think of our president to co-chair this?
Yes, certainly, yes. There are several factors. One, she's the second female president in the continent. But at the same time, you know, Malawi falls within the SADC region, which is considered to be the epicenter of the epidemic, where the bulk of the infection have occurred. And because Malawi as a country has championed the HIV response appropriately than other countries, you will realize that Malawi has been the first country to engage into several things that other countries have not gone into, like the introduction of the HTC week, where we have tested about 7 million people countrywide. Secondly, when you look at the epidemic itself, it carries a feminine face, a female face, the bulk of the infections in the country. And so there is a connection by giving a voice to a person who comes from a major voice and championing of the response from the global south, especially the sub-Saharan Africa. And they found it appropriate that Malawi should champion the cause itself.
Right. So if we are talking about HIV and AIDS, I think the first organization that comes to mind quickly is National AIDS Commission. Mr. Bisika, we are talking about UNAIDS Lancet Commission talking about ending AIDS. But in the case of Malawi, do you think this is really attainable?
Well, I think in Malawi, we have come a long way in the national response to HIV and AIDS. If you recall, sometime around 1994, 95, 96, we used to record about 130,000 new infections every year. And as we are talking now, we are recording just over 50,000. So it means already we have been able to cut the number of new infections by more than 50%. If you look at the issue of AIDS-related deaths, I think the peak was around 2004, when the country was recording close to 94,000 deaths every year as a result of AIDS. As we're talking today, we have also been able to slash that in half. I think we're just recording over 40,000 deaths every year. So we are making some progress in that regard. And as the Reverend mentioned earlier on, I think we have been able to get people tested for HIV. We have tested close to 7 million people now. And as you know, testing is the entry point to all HIV and AIDS services. If you are going to provide PMTCT services, if you are going to put people on treatment, whatever you're going to do in HIV AIDS, the first starting point is, of course, testing and the counseling. But again, as you know, Malawi was one of the first countries to adopt a policy where all HIV positive pregnant women are put on ARVs. This virtually means that we're eliminating the transmission from mother to child for HIV infection, and this is an intervention that as a country has taken us closer to an HIV-free generation.
Mm-hmm.
So the whole fight on HIV at least starts with an HIV-free generation.
Mm-hmm.
And I think as a country, we are doing very well.
And do you think ending AIDS is attainable?
That is our objective, and
Mm-hmm.
we think that if we intensify these interventions, we should be able to manage AIDS in the country.
Right. Dr. Mwansambo, you are heading the Ministry of Health, that is, you are the PS there. Ending AIDS in Malawi, I think to some extent, will depend on the quality of treatment that you are giving to people. But how prepared is the nation in trying to give quality treatment to people that will really forge us ahead in trying to end HIV/AIDS?
Maybe before I come to the treatment, I need to emphasize here that the first thing as a nation we have to embark on is prevention.
Mm-hmm.
Prevention is always better than treatment. And as was already mentioned by the Executive Director of the National AIDS Commission, we've actually come a long way from way back in the 90s to now, where we've reduced the number of new infections. And the main reason for reducing that number of new infections is a few measures that we put in place to prevent acquisition of this virus. And I must say here that as a nation, we have a duty to prevent ourselves getting infected. And treatment alone is not the answer. I thought I should emphasize this to make sure that Malawians out there know that we have a duty upon ourselves to stop ourselves getting infected.
Mm-hmm.
And we've communicated the message out there. So the good population in Malawi, over 90%, know how you can acquire HIV. So we need to put in measures to make sure that we are adequately protected and we stop ourselves getting infected.
Now about treatment, yes.
Question of
yeah.
treatment now. We as a nation, have put measures in place to make sure that as many Malawians are covered by treatment as possible. But this treatment doesn't come cheap. So that's why I was emphasizing on the treatment. But I should say here that we have, together with our partners, we have the treatment that's very effective, and if our people that are taking it actually adhere to the guidelines that we put in place to take it, then we should be able to conquer the epidemic.
But as we are talking now, there are reports that resources, for HIV/AIDS intervention, that is, resources towards this fight against AIDS, the resources are really going down. But as Malawi, do you see us winning this battle with the scenario that we are in?
Yeah, globally, as you know, that resources generally are not readily available, and more so for this fight against HIV. So that's why I was emphasizing on us preventing, or emphasizing on the prevention. But at the same time, I should say that we need to now start looking at alternative options of supporting these HIV treatment programs. So at present, we are relying so much on the Global Fund, but I think it's time that as a nation we started maybe involving the private sector, looking at issues around health insurance and so on and so forth, so that we can sustain it beyond the current period. But I must emphasize that indeed, as you said, the resources in the area are dwindling. That's why this meeting that's happening here end of this month is very important, because it also garner resources from the various other quarters, and also look at the post-2015 agenda, where we look at life beyond AIDS to sustainable health.
All right. Reverend McDonald Sembereka, this is a high-level meeting. Can you just tell us maybe some of the key people that will be available during this meeting?
In short, I would say that those people who matter in the fight against the epidemic. Suffice to say that there are several categories of people in the fight against HIV and AIDS. There are politicians, heads of states and government, who are coming because we need political will in the response to the epidemic. That leadership that comes from our politicians is pivotal if we have to make even in the fight. There are scientists coming, medical practitioners, the funding partners, the donor community. You may be pleased to know that even your colleagues in the media are part of the champions in the response, and one of them is Riz Khan. He's coming from Al Jazeera to be part of this. It's going to be a broad-based commission. The composition really takes care of various actors, as I earlier on alluded to. But suffice to make to say that we have, the response has always been a multi-sectoral, and multi-layers of players are critical. Both community activists, those in the medical field, and those in the political arena. And of greater importance also are those who have been supporting us in responding to the epidemic, like the Global Fund Executive Director and others.
Well, this is a panel discussion, a special program coming to you on MBC, and of course this is in preparation for the UN Lancet Commission from AIDS to Sustainable Health that is going to take place in the country from 28th to 29th of this month. And we have a panel of people, reputable people from Ministry of Health and of course from National AIDS Commission. Going back to you, Dr. Bisika, what is your role in the preparation of this summit?
The National AIDS Commission has been designated as the local secretariat for the summit. The main secretariat for the commission is actually UNAIDS and is based in Geneva. But for purposes of planning the meeting, there is an organizing committee that has been set up in the country, which is being chaired by the office of the president and the cabinet. But National AIDS Commission has been requested to provide secretariat support. So we are servicing that organizing committee. So for us, really, we want to make sure that the summit takes place in the best of conditions, and also we want to make sure that especially the people who underwrite the costs of the response. The reference has already indicated that the head of the Global Fund will be in the country. So we also want to make sure that we give an opportunity for the head of the Global Fund to visit some of our programs and activities, but also to allow the other delegates to see also the better part of Malawi, because sometimes it's not only the summit that matters. Some people also want to know what this warm heart of Africa is all about. So as NAC, you are working as a secretariat.
Yeah, oftentimes when people talk about issues, sometimes the people that issue is concerning sometimes complain that maybe people are just talking for them. There is a popular, I think, quote that the president often uses: "Nothing for us without us." This time around, are you involving those people that are really affected or affected with HIV/AIDS? How have you involved them? Back to you, Dr. Bisika.
Okay, thank you very much. Yes, I think in the first place, as you know, National AIDS Commission itself, as a commission, we are a stakeholder-based institution. So on the commission, we already have the sector that represents people living with HIV/AIDS. So even as an organization, we take that into account. But for this summit, we have also involved the sector specifically by ensuring that as part of the advocacy, there will be a young person living with HIV who is going to speak during the opening ceremony. The whole idea is to, as we are talking about an HIV-free generation, want somebody who is young to be able to share some experience with HIV in Malawi and to comment on how adequate our response has been, especially when it comes to young people. As you know, the future course of the epidemic in Malawi and in most countries will depend on what will happen among the youth. So actually, the youth hold the key to this whole fight against HIV and AIDS.
Okay. I'm also aware that WHO has recommended new drugs. I think new drugs, new ART drugs. But I wanted to find out from the government, from the Minister of Health, when are we going to be, as a nation, when are we going to transition this ART to the new ART to the clients?
I don't like the word new drug.
Are they odd?
But
this is the word that is used.
Yeah, but I think maybe let's use the word new recommended regimen.
Okay.
Because some of these drugs have been using them in the sector for a long time. I must say here that in medicine, for any condition, you use the best possible combination of drugs to come up with a good effect. So over the years, we're using a drug called Triamine, which are 3 drugs. But it was discovered in the process that there was a drug in there called Stavudine that was causing major problems in many people. But I must emphasize here that we've used this drug for more than 10 years now. So it has lived, it's done its purpose. Now it's time to move on. So to come back to your question, in 2010, WHO indeed did come up with new recommendation, and this time around, they used a drug called tenofovir as the anchor. So tenofovir with 2 other drugs is what is now being referred to as a new regimen. So I'm pleased to report here that we already started some groups of people on this regimen. So initially we started with the pregnant and breastfeeding mothers. We also started on TB patients and also children and those that were failing on the regimen. So we started that more than a year ago. But what our intention is now is to make sure that everyone, every patient needing ART is moved on to this tenofovir-based combination come July this year. So it's not that we starting new drugs. I'm emphasizing this because there are some people that we already started on the tenofovir-based drug that may be stopping it thinking that there's something new.
Oh, yeah.
You understand?
Yeah, that's very right.
Yeah, that's why I'm emphasizing this point, because this is a drug that we've been using in some groups of people, but now we're spreading it on to the rest of patients needing ART.
Now, how sustainable is this ambition plan?
I would call it ambitious.
Excuse me.
We have a whole lot of drugs there, so as now we're giving patients this drug. Of course, just like maybe we went with Triamine, there'll come a time when we assess the usefulness or the effectiveness of this drug combination. As always, we would look at the risks versus benefits. And at the point where the risks far outweigh the benefits, we may then move on to another recommended regimen. But as of now, this is the regimen we're using, and as government, we have a duty to make it available to the people. And by come July, every one of our patients will be on it.
Right. Going back to you, Dr. Bisika, recently Her Excellency Dr. Joyce Banda was appointed by AIDS Watch Africa as champion for AIDS, tuberculosis and malaria. On top of this, the president is the team of the Global Fund Replenishment Campaign. What will this benefit Malawians, these two appointments? Do you see Malawians benefiting anything from the appointments, or we should expect the president herself to benefit? How do you look at this?
Well, to start with, I must say that it's a great honor for Malawi, both the government and people of Malawi, for Her Excellency to be the champion of AIDS Watch Africa for SADC, which is the worst affected region when it comes to HIV and AIDS. And I must say that this did not come on a silver platter. It's because of the kind of leadership that Her Excellency has provided in the national response. As you know, Malawi has always been on the cutting edge in as far as a response to HIV and AIDS is concerned. So being given this role in a region where the battle against HIV and AIDS will be won and lost, I think it's a great honor for Malawi, but also it means that there's a lot of trust in the leadership. Again, as I mentioned, the Global Fund is the biggest sponsor in Malawi. Actually, the Global Fund currently pays for all the drugs for the ART program, which the Ministry of Health is implementing, including drugs for other opportunistic infections, condoms, and also test kits. Global Fund is covering that. And so far, Global Fund has committed over 700 million United States dollars to Malawi. So by asking Her Excellency to champion the Global Fund replenishment, for sure, she will make sure that she does not forget herself in the exercise. So Malawi stands to benefit. And the fact that Her Excellency has been asked to champion that, it means that Malawi is going to benefit. And already I can tell you that 115 million United States dollars have already been earmarked for Malawi for 2014 going forward. So we are going to benefit in terms of publicity, advocacy, but also resources, as it were.
Right. Very soon we'll be going, I think we'll be winding up the program. I want to hear from you, Dr. Mwansambo. What could be your last call, maybe to Malawians and the other sectors that you're working together with in this fight, as Malawi is yet to host this commission?
I need to state here that HIV or AIDS is not just a health issue. It extends beyond Ministry of Health, and it's a developmental issue. And all of us, as Malawians, have a duty to play. We all know how we can get infected. It's our duty to prevent ourselves getting infected. But once we're infected, all is not lost. We need to make sure we get tested, go on to treatment, and adhere to the treatment. That's the message I have.
Reverend McDonald Sembereka, you're working with the president, but I know you as also an activist, somebody who has worked in the civil with the non-government organizations for quite a long time. And these organizations are also in the forefront, trying to support government in the fight against HIV/AIDS. What can you say to them regarding this fight that we have? We have really a big challenge ahead of us because HIV and AIDS is really claiming a lot of lives.
Yeah, I think it's important for us to emphasize the fact that although we have made a positive stride or positive strides in the national response, we don't need to be complacent. We need to step ahead in making the right decisions, the right approaches. We are calling for today. The response calls for innovativeness. And by innovativeness, we mean that we should think outside the box and make sure that we explore what is value adding in the response. Ensure that those people who are HIV positive live a healthy life beyond what people would have envisaged of them. And those who are HIV negative live continuously as such, and that all players contribute to this national cause, because the future of this country lies in all of us, and by making sure that we provide the relevant interventions so as to also safeguard the generations to come for this country.
And finally, the National AIDS Commission, you are the key player in this fight against HIV and AIDS, and you are the channel of all resources going towards this fight. What could be your last word as we are winding up the program, and again as we are waiting for the holding of this particular commission? What can you say to Malawians, those that are watching us, in terms of the efforts that are there to fight HIV and AIDS?
Well, I think I must emphasize that the National AIDS Commission is a public institution, and actually it is in the office of the president. And as a commission, we entirely agree with the leadership. I think the president has made it very clear that we have made a lot of progress in the response, but AIDS is still here. We are not yet out of the woods. And Her Excellency has said that it is incumbent upon each one of us to ensure that one day we can talk about an HIV-free Malawi. So we all have a role to play to end AIDS. That's how I would conclude. Okay.
Thank you very much. Well, dear viewer, that's what we had in this panel discussion. This was a special program to you as Malawi is preparing to host the UNAIDS Lancet Commission from AIDS to Sustainable Health, and this will take place at Bingu International Conference Center in the capital city, Lilongwe, from 28th to 29th of June, this very June. My name is Peter Makawa. I've enjoyed your company. Bye for now.